Welcome back. In this session, we will discuss another homeopathic remedy called Anthracinum. Anthracinum is a nosode. It is a product of anthrax poison. It is an alcoholic extract of the anthrax poison which is prepared from the spleens of the affected sheep. So you can see the anthrax poison or anthrax. This anthrax is taken from the spleens of the affected sheep and mixed with alcohol, potentized, and we prepare the anthracinum. So we see it is a nosode since the product is prepared from the deceased part of an animal. It is a nosode and it is a product of anthrax poison. Anthracinum was first introduced into homeopathic practice by Lux. So anthracinum was introduced by the prover Lux long before the experiment of Pasteur. So we know the experiment of Pasteur, Louis Pasteur was the one who said that the disease is caused by microorganisms. He discovered that the disease is caused by microorganisms, and the Lux, even before the Louis Pasteur could detect the microorganisms and the growth of the microorganisms in the lab, in the presence of air, he saw that in the presence of oxygen, he saw that microorganisms used to multiply, and once the flask of the neck of the flask was closed, he detected that the microorganisms don't grow. But that is not of much importance here. You just have to know that even before the Louis Pasteur could discover the microorganisms, Anthracinum was brought into homeopathy by Lux. It has got a very important and respected place in homeopathy because it has got the power to make the surgeon's knife useless. It relieves the most serious cases. So the anthracinum, so we see it is not a polychrist remedy. It has a very little sphere of action. Still it is gaining a very important and respected place in homeopathy. Even though it has a limited sphere of action, it has lot of respect in homeopathy because it has a wonderful power of making the surgeon's knife useless. How can it turn the surgeon's knife useless? By curing the most serious surgical cases like carbuncles, gangrene, phelons, blood boils. So you can see the picture here. The most serious cases like carbuncles, and we have phelons. So what is a carbuncle? Carbuncle is nothing but when a hair follicle is infected. The infection of the hair follicle, which is extending into the surrounding tissues, and when it involves the subcutaneous tissue, it is a carbuncle. And you can see the phelon here. Phelon is also the infection which is occurring in the closed compartments like the fingertip pulp. You can see the pulp, the fingertips pulp. The pulp is all swollen, so this is a phelon which is occurring in a closed compartments like the tips of the pulp of the fingertip. And we have a carbuncle. It also cures the blood boils, phelons, gangrene. Okay. Clinically, where is the anthracinum indicated? It is indicated in acne, blood boils, carbuncles, insect stings. You can see the picture here. The insect stings. It is indicated in insect stings, malignant pustules, phelons, like we saw here, phelons occurring in the fingertips, the pulp of the fingertips. Okay. And we have septic fever, splenic fever because of the affection of the spleen. We have splenic fever, septic fever, the dissecting wounds. You can see the pictures here. The carbuncles, phelons, we have carbuncles, phelons, insect bites. And it is also used in dissecting wounds, septic fever, splenic fever, anthrax poisoning by foul breath, foul gas. When there is an anthrax poisoning and the patient has a foul breath and a foul gas, then we can indicate anthracinum in that case. What is the sphere of action? I told you it is not a polychrist remedy. Very limited sphere of action it has got, yet a very respectable place in the materia medica. Anthracinum has its main center of action over the connective tissues. We see the connective tissues here, the cartilages, bones, adipose tissues, blood cells. It has a main action on the connective tissues. It has covered all the inflammatory conditions of connective tissue. All the inflammatory conditions of connective tissues is cured by anthracinum, in which there exists some purulent focus. When there is pus formation, then we can think of anthracinum. All the inflammatory conditions followed by purulent. Okay, you can see the pus oozing out from here, and the phelon filled with pus. So in the conditions which are having a purulent focus, it also acts on the skin. Obviously we saw acne, blood boils, phelons, gangrene, carbuncle. So it acts on the skin. Moving further to the guiding symptoms of anthracinum, there is atrocious burning. So what do you mean by atrocious? Atrocious is this brutal, very, cruel, wicked, very severe, very cruel burning, brutal burning, severe burning. The severe burning pain, as if the hot coals were applied to the part. Just imagine the extent of the burning. The patient feels as if the hot coals were applied to the part. Similar condition where the patient feels as if hot coals were applied to the part. The coals applying to the part is also seen in cases of Arsenicum album. The discharges. The discharges are ichorous, putrid, offensive. We see they are very acrid, ichorous. They are putrid, pussy, and then we have very offensive smell coming from the mouth, the nose. The discharges from the mouth are very offensive in nature. The discharges from the nose, throat, nostrils, vagina, rectum, the discharges from the ulcer, the pus which is oozing out from the carbuncles, ulcers, is horribly offensive. So the discharges being offensive is also seen in cases of arsenicum album and pyrogenum. So guys, we see it is having resemblance to arsenicum album in having the sensation as if they have a burning, not sensation, the actual burning, the actual burn. They feel as if the hot coals were applied to the part. And the discharges are very offensive, putrid and acrid or ichorous, similar to that of arsenicum album and pyrogenum. The hemorrhages in anthracinum are black, thick, tar-like. You can remember the picture here. The anthracinum discharge is very black. It is pitch black. It is thick. You can see the discharge being thick, tar-like discharge. It decomposing from any orifice, whether it is from the nose, mouth, vagina, rectum, doesn't matter which orifice. What is the character of discharge in anthracinum? It is dark, thick, tar-like, rapidly decomposing. There is a tendency towards malignancy. So they have a tendency towards the cancerous conditions, malignant conditions, and there is rapid formation of gangrenous condition. The death, the necrosis occurs, and there is gangrene, the death of the tissues occur. Following the malignancy, there is formation of gangrenous condition. Fever with a rapid loss of strength. The patient has fever. Along with fever, there is loss of strength and a great prostration. Completely weakened. The person is weakened. The sinking pulse, delirium and fainting. Patient has a sinking pulse, delirium and fainting. Affected parts will turn black and blue. Clear, guys? How is the fever? Fever, there is rapid loss of strength, prostration, pulse is sinking, delirium and fainting. Affected parts also will turn black and blue. Red lines from the area of infection is marking the course of lymphatics. You can see this is the area of infection, and from the area of infection a red line is marking along the course of lymphatics. The red lines from the area of infection are going to mark the course of the entire lymphatics is marked by the red lines. Rapid spread of infiltration and edema of cellular tissue. You can see the edema of cellular tissue. There is rapid spread of the infiltration, which means the malignancy is spreading quicker and faster. There is rapid spread of the infiltration, malignant conditions associated with edema of cellular tissue. Thirst, they have excessive thirst with an inability to swallow. How is the thirst in Anthracinum? Excessive thirst with an inability to swallow. In carbuncle, malignant ulcers and complaints with ulceration where there is slowing and intolerable burning. So, what are the indications? Now, let us see what are the indications of Anthracinum. Okay, what are the indications? We have carbuncle, malignant ulcers. They have complaints with ulceration. How is the ulcer? It is slowing ulcer and with an intolerable burning. They have an intolerable burning. This is a carbuncle. You can see a carbuncle and ulcers. They have slowing and intolerable burning. Very important, burning. Burning like that of as if the hot coals were applied to the part. When arsenicum or the best selected remedy fails to relieve the burning pain of carbuncle or malignant ulceration, then we think of anthracinum. When arsenicum fails or the best remedy fails to relieve the burning sensation, we think of anthracinum. So we see, let us just make a quick comparison between our salve and this anthracinum. In our salve, we have the same atrocious burning. They have a burning pain, ichorous offensive discharges, prostration, ailments from dissecting wounds, and anthrax like anthracinum. But unlike in arsenic, pains are relieved by hot application, and there is great restlessness. Especially in the midday aggravation, midnight aggravation, and they have thirst for little quantity of water at short interval. Okay, this is arsenicum album. Now we'll see here what happens in case of anthracinum. Anthracinum, it is having hemorrhages. Okay, we will just see this. We have studied about the carbuncles, malignant ulcers with ulceration, sloughing and intolerable burning, and the similar is present in arsenicum album, and they have excessive thirst, whereas our salve has a little quantity of water. They have thirst for little quantity of water. Hemorrhages. In cases of anthracinum, the blood is oozing from the mouth, nose, rectum, anus, sexual organs, which is black, thick, tar-like, and it is rapidly decomposing. Similar in cases of Crotalus horridus. Gangrenous ulcers, phelons, carbuncles, erysipelas of a malignant type. We see malignant erysipelas. Malignant erysipelas in cases of anthracinum. The phelon, the worst cases of phelon with slowing and terrible burning pain. So we have this terrible burning pain in cases of anthracinum. It is also indicated in arsenicum album, carbolic acid and lachesis. Malignant pustules, black and blue blisters, often they are fatal in 24 to 48 hours. These blisters are fatal. Similar black and blue blisters are seen in lachesis and pyrogen. You can see here the blisters. You can see these things in cases of the malignant pustules, blue and black blisters, which are going to cause, they are very fatal in just 24 to 48 hours. They turn out to be fatal. Dissecting wounds, especially if there is a tendency to become gangrenous, even the dissected wounds, whatever the wounds which are dissected, if they have a tendency to turn out to be gangrenous, septic fever, marked prostration, again arsenicum alb and pyrogenum, insect stings. If the swelling is changing the color and the red strings are red strings from the wound map out the course of lymphatics. We have studied all of this in the guiding symptoms. Septic inflammation from the absorption of of pus or the deleterious substances with a burning pain and great prostration. If there is septic inflammation from the absorption of pus or any other deleterious substances, harmful substance, if there is an absorption of a harmful substance, there is burning and great prostration. And because of the absorption of a harmful substance, if there is septic inflammation, so we see it occurs when these harmful substances are released into the bloodstream, and because of the triggering of the inflammatory markers, the inflammatory response occurs in the body, which is resulting in septic inflammation. Herring says to call a carbuncle a surgical disease is the greatest absurdity. So he says that it is greatest absurdity to call a carbuncle a surgical case. Okay, you are not supposed to consider the carbuncle as a surgical case. It is just ridiculous. It is ridiculous, unreasonable if we consider it to be a surgical case. An incision will always turn out to be injurious, and it is often a fatal conditions, resulting in fatal conditions. A case can never be lost under the right kind of treatment. It should always be treated with an internal medicine only. So we are concluding our session with a little part of organon of medicine, where Hahnemann speaks about giving the internal remedy. It is the internal remedy which cures the case and not the external palliation. We cannot just treat the carbuncle surgically. It will always cause injury to the patient and it will turn out to be fatal. We always have to treat the cases with the internal medicine only. Okay, so we know that it turns the surgeon's knife useless. Sorry guys, it turns the surgeon's knife useless. Anthracinum is so important in homeopathy. It has a great reputation. It holds a great importance because it has this power to make the surgeon's knife useless, and it will relieve the serious conditions of carbuncles, gangrenes, phelons, blood boils. So this was all about the Anthracinum, a nosode Anthracinum. Thank you. I feel all the points are clear. If you have any doubts, feel free to put them down in the comment section. And if you like the video, don't forget to hit the like button and subscribe.